Okay, sir, my name is Vicki and I'm going to be your nurse today. I'm just going to be assessing your abdominal and your urinary system. I just have a couple of questions for you to get started with. Could you describe your appetite to me? Do you have a normal appetite?
I would say it's normal.
Okay. How many times a day do you eat?
Twice.
Okay, and do you eat large meals?
Yes.
All right. And have you noticed any change in your appetite in the past 24 hours?
I'm not hungry after I eat.
Have you noticed any change in your appetite though? Have you noticed a decrease or an increase in your appetite?
No.
What about in the last month or the last year?
No.
Okay. And what is your weight approximately?
185.
Okay, and has your weight changed at all recently?
Yes.
Okay, and how has your weight changed?
I lost 15 pounds.
And were you trying to lose weight?
No.
Were you dieting, exercising, anything?
Exercising.
Okay. And then I'm going to ask you to describe your bowel habits for me. So, bowel movements. Do you have bowel movements on a regular basis?
Mm-hmm.
Do you have bowel movements every day?
Yes.
Okay. And how often? Just once a day? Okay. And I know these are strange questions, but I just have to ask you the color and consistency. So is it a normal brown color, soft, hard, formed?
Changes every day.
Okay. So what's your normal?
I don't study it.
Okay. So is it brown?
Yes.
Okay. And do you have formed stools or is it liquid, loose?
Formed.
Okay. And are you having any feelings of bloating or an increase in gas at all right now, recently?
No.
Okay. And are you having any physical problems affecting your appetite or your bowel function?
No.
Any abdominal problems that you know of right now?
No.
Does anyone in your family have a history of abdominal disease or problems?
Yeah.
Okay, and who in your family has a history?
My father.
Okay. And what did your father have? With his
Something wrong with his gallbladder.
gallbladder. Okay. And did he have his gallbladder removed?
I think so.
Okay. Have you ever been diagnosed with any abdominal diseases or?
Mm-hmm.
Yes, and what were they?
Appendicitis, pancreatitis, liver, alcoholic liver hepatitis.
Okay, and for your appendicitis, you had your appendix removed?
Mm-hmm.
And do you know around the year that you had your appendix removed?
2001.
Okay. And pancreatitis, what year was that?
This year.
Okay. And the liver hepatitis?
This year.
Okay. And the causes of the pancreatitis and the liver hepatitis, did the doctors tell you what they believed caused that?
Say what?
Did the doctors tell you what they believed caused your pancreatitis and your liver hepatitis? Okay. Are you currently having any nausea or vomiting? And are you currently having any pain in your abdomen?
No.
Okay. Now I'm just going to go ahead and ask you about your urination. What are your normal patterns of urination? Do you urinate every day?
Mm-hmm.
And how many times approximately do you feel that you urinate?
3 or 4.
Okay.
Maybe more.
Have you noticed any changes in your urination? Any changes in the frequency of urination or the color of your urine? Any pain, discomfort?
No pain, but.
Okay. Any changes in the frequency?
Mm.
No. And what about color?
Always changes.
Okay. Is it like normally yellow? It's not real dark?
Always changes, but that's the day.
Okay. What's your norm? Is it like a clear to yellow?
Sure.
Okay. And after you urinate, do you feel like your bladder's empty or do you feel like you still have to pee? And are you able to control when you urinate? Or okay. Do you have any nighttime urination? Do you get up often to pee during the night? And do you have any difficulty starting the flow of stream?
Yep.
Any family history of kidney disease or urinary problems, prostate, anything?
Yep.
And have you had a recent urinalysis done?
Probably.
Do you think you had one done this year when you were in the hospital?
Probably.
Okay. Did the doctors tell you about any problems with your kidneys or your urine? Okay. And have you ever had a diagnosis of kidney disease or bladder problems? A history of kidney infections?
No.
And any surgeries on your urinary system?
No.
Do you have a history of increased blood pressure or diabetes?
No.
Any family history of that?
Yes.
And again, who's that?
My dad.
Okay.
And my grandmother. And
Is that increased blood pressure, diabetes?
I think all the above.
Okay. And are you aware of any neurological conditions that you have?
No.
Okay. Any cardiac conditions? Anything with your cardiovascular system? Okay, just a couple more questions here. You haven't noticed any color in, any changes in the color or an odor or anything like that to your urine?
No.
No cloudiness, anything like that? And you stated no pain when urinating, is that correct?
Correct.
Okay. And have you ever been diagnosed with any prostate problems? Okay, so what I'm going to do after I'm done asking you questions, I'm just going to go ahead and inspect your abdomen, and as for inspecting, I'm going to look at your abdomen, I'm going to listen to it, and then I am going to be palpating it, which is just feeling around, making sure you're not having any soreness or anything like that, okay?
Okay.
Okay, if you'll just lay down for me. Okay, so I'm going to go ahead and lift your shirt so that I can look at your abdomen. Okay, and can you just put your feet out straight for me, please? Okay, now I'm going to go ahead and take a listen. Okay, that's good. You have active bowel sounds in all areas. So now I'm going to go ahead and feel around, okay? And you let me know if you feel any tenderness or pain. Feel any pain whenever I'm pushing on your stomach? Any pain there?
Nope.
Okay. I'm going to go ahead and feel over here. This is where your liver is located. You let me know if you're feeling any pain. Okay. And then I'm going to check over here where your spleen is. Any pain?
No.
Okay. All right. So now I'm going to do something that's called percussion. And this is just to hear, I'm going to tap on your stomach, and it's to listen and make sure that everything's sounding as it should, okay? Okay, good. you notice that there was a hollow sound. That's how everything should sound. Okay, you can go ahead and pull down your shirt. I just have a few teaching things to go over with you. If you want to go ahead and sit up.
No.
Okay, so I just have a couple of things that I want to go over with you. As far as your urinary system, everything seems to be in order. You're not experiencing any issues right now. I know you're still not there yet, but once you would turn 40, you'll want to go ahead and have prostate exams on a regular basis. That would be once a year. Your doctor is going to inspect your prostate. They do that by putting a finger in there and inspecting to make sure that everything is in order. What can happen, sometimes your prostate can become inflamed. If that would happen, the prostate goes around your urethra. So if the prostate becomes inflamed, you would notice things with the change of your stream. So if you would have